Welcome to Through the Trauma podcast. My name is Amber Larkins, published photographer, storytelling expert, visual artist, entrepreneur, speaker, and coach. This podcast was born from one question: how do I get inspiring stories of triumph out to the people who need to hear them the most? Come with me, enter my world, where lives are getting changed, heroes are getting developed, and greatness is being achieved. Hello, and welcome to another episode of Through the Trauma podcast. I am Amber Larkins, your host, and today I have with me a very special guest who does something that is very near and dear to my heart. If you know me, you already know Miss Momoko Uno. She is a doctor of integrative medicine. She's a certified functional medicine practitioner. She's a licensed acupuncturist, board-certified herbalist, and she has a master's in spiritual psychology with an emphasis on consciousness, health, and healing. She has published 2 books, and she is the owner and founder of Omni Wellness. Momoko, thank you so much for being here with us today. I cannot wait to jump into a conversation with you.
Thanks for having me on your show.
Yeah, this is so awesome. I get excited anytime someone comes on the show and wants to talk about functional medicine and health, because I think there's a big deficit of it especially here in the United States. I can't speak to other countries. Maybe you can, but I know that it seems there's a real deficit, and people, I feel like, are getting more aware of the issues and the benefits of practicing like functional medicine. But what are your thoughts on that?
Well, I'm in New York City, so it's very progressive where I am, but I do agree that alternative medicine in general and functional medicine has gained more popularity recently, especially in the last, I would say, 10 years. I think the majority of my patients at some point have already done some kind of functional medicine testing, which is encouraging to see. And I think the mainstream medical field is becoming more and more aligned with it, and at least more open. In the past, I would have patients who would take their tests to their doctors and it would get completely poo-hooed. And at this point now, it's unusual. I would say that, if they come in with some kind of a GI issue and they come in with test results, they'll just take those results and treat accordingly, which is promising. I'm glad to see that. And a lot of doctors are beginning to understand the relationship between diet and health. And because for a long time, when I first started practicing 25 years ago, I often heard from doctors who would say that your diet didn't matter. So we've come a long way.
Which is such a crazy, I can't even wrap my mind around how someone could ever even believe that. It's like what you put into the body is going to have an effect in the output that you have in the body.
Yeah, there's something about medical training, and, I can also talk about my own personal training too, but it can sometimes make you, like, too much education can kind of drain common sense sometimes, if that makes sense. But yes, I've heard lots of GI doctors tell my patients that what they're eating does not affect their gut. It's slowly changing though. Happy to see.
That's definitely encouraging to hear, and to hear someone in your industry, because obviously I'm not in that industry, so I have my perception of what's going on. But to hear someone in your industry say that you're seeing this kind of turn around, it's very promising, and it gives me hope for the future. I will say personally, I've seen, just from being on social media and following some things and being into the wellness and fitness, being into that, having interest around that, I will say that I think there's more awareness around it these days, why it's important and why we need to be healthier and why we need to focus on these things that's going to make us healthier.
And about trauma too, and trauma's effects on the body as well. I think that it's becoming more known and accepted that trauma does affect the physical body. It's not just an emotional issue, that there's physical impact too.
Yeah, and I'm very curious. I want us to get into some conversations around how these trends that you're seeing. But I want to ask you first, what kind of created this interest in you to choose this line of work?
So in Australia, this is where I grew up. So when we were around 14 years old, I went to a very, very progressive school. And it was encouraged that we as young people start thinking about our career. And so it was at that age that we started meeting people from all sorts of different types of professions. And I think that really molded what I thought about my career and what I wanted to do. Also, the fact that my mother was actually quite ill from a young age, and seeing her ill, and then also her path of choosing more alternative methods. She would often go see an herbalist, and I saw how that helped her, and she also gave me some herbs as well, which I thought were absolutely disgusting, but I did take them as a child, and I felt like I benefited from the results as well. So I was exposed to it from a young age.
Gotcha. Gotcha. Did your mom adopt the alternative medicine route, or how did she handle that when she got diagnosed with being sick?
She had an integrative approach. So she always was on medication, but was also doing herbal medicine and alternative modalities on the side. And I think that must have greatly influenced my decision to go into integrative medicine.
Yeah, that's so awesome that she chose to do that. I think so many times people, they kind of blindly take the advice of doctors because they look at them as experts and they don't do their own research. Do you find in your practice when people come in to see you that they have done a little bit of research, or they're coming to you because the modern medical industry has failed them?
I think a bit of both. So in New York City, a lot of people are very well informed and educated. Often I feel like I'm the one that's learning from them. And they'll tell me about all these things I hadn't even heard of that they've been doing. So I think that's great to feel like I'm learning from people too. And sometimes I am the one that needs to catch up. Hopefully I'm also adding different options for those people who have already done a tremendous amount of homework. And I might be able to suggest something that they haven't thought of or haven't done in the past. And then there are also people who have had absolutely no exposure to alternative medicine, or have just been doing things that they've been told to do by their doctors, and have figured out it's not working for them. The medication that they have been prescribed is having side effects, or it's not working that well. And they've run out of options, and they've seen various different doctors, and I am, the doctor number 10 or something that they've come to see.
Yeah, I would think you would probably see a combination of those. So you do a lot of different things. I mean, there's a lot there. Integrative medicine, can you kind of explain what that term means for those who maybe don't know? And I'm not even sure I'm 100% clear exactly what that means.
So integrative medicine isn't actually, I have a doctorate in integrative medicine, which actually isn't a standardized term. There are a lot of people that consider themselves integrative doctors, but they might just be integrative. Just means that you're mixing and matching different forms of medicine. So you could be doing Western medicine, and then you could be doing some nutrition on the side. You could be a chiropractor that does functional medicine. So if you just add two different modalities and put them together, all of a sudden you're an integrative doctor. In my case, I actually went and got a doctorate in integrative medicine, which means that I studied all sorts of different forms of alternative medicine. Not everything that's under the sun, but many, many different forms. Some I've even forgotten now because I haven't, it's been a while since I went to school, and I didn't, I don't use those modalities. But it was fascinating. Some of them, obviously, I practice lots of different forms of alternative medicines, but there are many that I don't practice at all.
Gotcha. I've always kind of wondered that. Like, what exactly does that entail? Integrative medicine. So thank you so much for explaining that. And then when you say certified functional medicine practitioner, so this is your actual, like, you're certified to be a doctor. Or am I wrong in that?
No. So my degree is in medicine, is in internal medicine. I have a degree in I got it from Shanghai University, and it's an integrative medical degree in Chinese herbal medicine and pharmaceuticals. So my training is mostly in blending pharmaceuticals with classical Chinese herbs together to see if we can enhance a better result for patients.
I'm very interested in this because I've dabbled a lot in, I don't know if you'd necessarily call it herbal, but like the essential oils, doing the oils, trying to mix together things like I've always tried to take the more natural, or I guess would be what you would call holistic approach when dealing with my kids when they get sick, or trying to avoid going to get put on medicine, because I personally think that there's an issue with the medical industry. I think it's backed a lot by money, and they push things that are not always needed. Now, that's not to discredit. I actually have my nursing degree, so I understand. I mean, not obviously not nearly as much as you, but I do understand there's a time and a place and a need for, modern Western medicine, but it's not always the thing that we should jump to. And so the pediatrician that I take my kids to, she's a integrative medicine. I never really knew what that meant, other than she was always looking for a more natural approach to treat things and not so quick to give medicine for things. So I love that there's doctors like you out there that people can find that are not always trying to push just medicine always. I'm curious, like, what are your thoughts around that? Because I know people have different views and different opinions when it comes to, the modern medicine or the pharmaceutical industry, but I'm just curious, like, in what you've seen personally in your practice.
I think it depends on the individual person, and some medication have, I find, more side effects than others, and also certain patients do okay on medication like pharmaceuticals, and some patients don't. So it's very much to do with how the individual person is responding. So my general theory is, if it works, then it's great. You can keep doing that. If it's not working, then let's try to look for alternatives. Because what usually happens with a lot of the patients where we have a lot of side effects from a medication, then what a doctor will do is, rather than say, let's take you off this and try alternative medicine, they'll say, let's try another drug to counteract the side effects. And then you're on a second medication, and then that one has side effects. And then another doctor says, well, let's give you medication for those symptoms. And then before you know it, you're on 10 different meds, right? When what you could have done is just taken them off the first medication and tried alternatives. Now, that's nice in theory that sometimes that actually works, and I've seen that, but that's not always the case. That you do sometimes get a patient where they're on one medication and there's not a good alternative, like the alternative medicine doesn't work. And so what do? Then I end up giving that patient something to counterbalance the symptoms, from the side effects. And so it really depends. I don't like to think of, as you said, it's not Western medicine as bad or anything, but yes, it does tend to be overprescribed, and patients are often not listened to when they're saying that a medication is causing them side effects. I think that it's important to listen to patients and acknowledge them and validate their experiences, because otherwise they feel crazy if they're told that, that symptom, it shouldn't exist, right? That's not a great way to communicate with our patients. So I think that in some cases, medication is great and necessary, but there are, like, for example, one thing that I've noticed that happens a lot, and I'm sure you do too, is that, the overuse of antibiotics. I think there are times when, you don't really need them. The infection will just go away by itself if you just get enough rest and adequate fluids, and you use common sense, right? There are times when that infection is not going to go away and it's going to be dangerous, and you really do need to take care of it. So it depends on the situation, but I do think that antibiotics they're overly prescribed, and then you end up developing other problems on top of that. And that I see a tremendous amount of, the overuse of antibiotics.
Yeah, interesting that you bring that up, because I was actually going to bring up antibiotics, because I think that too. There's natural things that you can do that has antibacterial I'm probably not even saying that right, but
Yeah,
okay.
yeah.
I actually have a story around this. This has been probably 5, 6 years ago. I got strep throat on my birthday. So I was at the convenient care clinic, and I only went to the convenient care clinic because I needed to know if that's what it was. I already planned to medicate myself
Yeah,
because that's just how I am.
yeah.
But I'm like, I go to find out to test to see if that's really what it was, so I would know how to treat myself. So I go to the doctor and they tell me, "Here's this prescription for antibiotics." And I'm like, "Well, what happens if I don't take the antibiotics?" I never planned on taking them anyway, to be honest with you. And she said, "Well, if you don't take them, this will turn into something else. Like, it will not heal on its own. You have to take these antibiotics." So
Yeah.
I go home, I lose the prescription or throw it away, I don't remember. Started doing all of the holistic things. I will say I was probably that was the worst time I've ever had strep throat. I got really sick for about 5 days, but then my body healed. And I've not had strep throat since. And I'm curious, I would love to know your thoughts on this, but I think in my mind that by doing that, I've made my immune system stronger. So yes, my immune system had a lot to fight off. I used a lot of garlic and um, I was gargling with apple cider vinegar. I don't even know if that's the right thing to do, but that's what I was doing. And all of these things, I was doing. I was really sick for about 5 days. But then once it was gone, like I've not had strep throat. I've been around people with strep throat. My kids have had it. I have not got it again since then. And I feel like my immune system has fought that off and it's prevented me from then getting sick again. But I'm curious your thoughts with knowing how the immune system works. What are your thoughts around that?
Absolutely. I think that you make a valid point. If you are able to adequately kill the strep, then you're unlikely to keep getting it over and over again. Just to share my personal story, when I was actually in medical school, I had chronic strep throat. Like I had it for, I think I ended up having surgery as a result, and I think I had strep throat that, and I couldn't clear out this infection, right? And then eventually I took multiple rounds of antibiotics, which completely destroyed my gut, and I still kept getting sick even after having surgery. And then it was really only the herbs that I took after that completely cured me. So I think, had I really taken the herbs in the first place, I probably would have prevented going down this whole other path and destroying my gut too. So I think you made a really smart choice.
Yeah, I mean, I've not had it since, so I think so
Yeah,
too.
well, there you go. That's your evidence, right? That you did the
Yeah.
right thing.
Yeah. And there's another thing that I'm curious about is what I've always done with my kids too is I try not to give fever
Yeah,
reducers unless they absolutely need it. Like if their
yeah,
fever is getting up to like a 102 or 103, then yeah, we're going to give fever reducer.
yeah,
But or if they've not slept in days and they need to sleep,
yeah.
yeah, we'll give it. But if they have a small fever, like I believe in letting the body break its own fever, like fight through it. What are your thoughts on that?
And I think that if you have a fever that you can tolerate, not that you have to be very uncomfortable, but the fever's there for a reason. It's there to try to fight off the infection. And if you reduce the fever too much, it's going to reduce your body's natural ability to fight an infection. So I think it's important to be comfortable so that you can rest, but not to take the fever away completely so it compromises your immune system. It completely defeats the purpose. So I often tell people, if you can muscle through it, try to muscle through it. But if you can't sleep and if you're uncomfortable, then take the edge off. You don't need to
Mhm.
go back to normal baseline. That's not necessary. But and this also really depends on the person, because some people, when their temperature just goes up 1 degree, they feel really uncomfortable. I'm a complete wimp when it comes to temperature. Like if it goes up even a little bit, I'm going to feel super uncomfortable. And there are people who are walking around at 102 and 103, and it's like they're fine. So it's a very much of a subjective thing. Yes, the rule is only if you're uncomfortable and if you can't rest properly, or if you're having some other kind of reaction to the fever, then I would recommend that you address it. But it does unfortunately negate or minimize the positive immune system reaction if you reduce it too much.
I've always thought that as well. And it's always, well, I would say as a kid, I didn't do that because my parents, they kind of believed in what doctor says goes.
Yeah.
But as I got older, my ex-husband was really the first. His family was extremely holistic and they had treated a lot of things holistically. So this was my first introduction to really treating things holistically. And over the years, I can honestly say that it's served myself and my kids very well to treat things that way. Uh, but I do want to shift gears just a little bit and talk about trauma. Like we have, you mentioned this earlier, and we've kind of talked about this a little bit, but with trauma and how that obviously trauma affects the body because it affects the hormones and the stress, the stress hormones.
Yeah.
How do you see the nutrition and herbs and, the things that we're putting into our body work with fighting trauma or helping trauma? And specifically, I guess I'm asking about that stress response to trauma.
So if you have experienced trauma and you have your body's in fight or flight, you will be more naturally in an inflammatory state. So if you already have inflammation going on in your body, and then your resources, your blood flow is going to more your extremities, because just keep in mind that if you've got adrenaline and cortisol going into your system, it's there to go into fight or flight. So your muscles are going to be pumped to, and your blood is going to be in your extremities getting ready for that big fight, right? And where does it go? Away from your internal organs. And so it's like they're left somewhat unprotected. So you're more likely to get sick when you don't have your fighting capacity in your organs, and if that or your blood is in your limbs. So you're in a state of inflammation. And if you're in a state of inflammation and you eat inflammatory food, it's just, unfortunately, it's a recipe for more illness on top of that. And if you're having a high carbohydrate diet, processed foods, it's also going to make you more anxious too. So if you have trauma and you're having anxiety, which is usually one of the big symptoms, right, is you're going to feel even more anxious on top of already feeling anxious. So to have foods that, carbs in particular, are whole carbs rather than processed carbohydrates, so that it gives your system energy that's sustained rather than in peaks and valleys, it's going to make you feel much calmer. So just the diet, I think, will make you feel more grounded if you have a more natural whole food diet.
And an example of this diet, which I feel like I understand this pretty well, but like maybe for listeners that don't fully understand, like, can you give us some examples of that?
Yeah. So in general, if you think of a food that you can leave on the countertop that will perish fairly quickly. So, nothing that comes in a box, or if the box has all these ingredients that your grandmother wouldn't know if they have or wouldn't have heard of, that's usually a good rule to go by. If you read all these things and you're like, oh my God, what is this, preservative? I haven't heard of most of them either. So if you can't identify what's in the ingredient list, it's usually good reason not to eat that. Yeah. So fruits, but if you keep it to fruits and vegetables and lean meats that unprocessed meaning that it's not it's in its original form, hasn't been chopped up and it's looking like in the shape of a dinosaur or something. It's in its original shape. Yeah. That's usually the good way to I think to eat. Whole grains are usually fine for most people, and beans too. Ideally not from cans.
Mhm.
But
That's
if
a
you just think, yeah, fruits and vegetables, things that grow out of the ground and off trees.
Yeah. That's a very simple way to say it, and I appreciate you explaining that for sure. I've often also heard that when you go into the grocery store, try to stay on the outer the outer like try to stay out of the aisles because that's where all the processed stuff is.
I'm going to use that one from now on. I like that.
Yeah, I don't remember where I heard that. I've been in fitness for a long time, and it's just like, yeah, when you go in the grocery store, just stay on the parameter of the grocery store, not the aisles. Yeah, it's pretty true too. Like when you think about it,
Yes.
which is where I try to do the majority of my shopping, but it's hard with kids and
Yeah.
things to not get some processed foods. And honestly, this is so disheartening, but I recently had gone into the grocery store and just I'd taken my kids with me and they're, "Mom, I want this, I want that." And we're very picky specifically about food dyes. Like, I can handle some processed, but food dyes we don't do. And or we I try not to. When they're not with me, I don't know what they do.
Yeah, yeah.
But they, "Can I have this? Can I have that?" And it's like the majority of things they're bringing me is like, "No, you can't have that." It's the majority of things that are in this store are not edible. And it's edible in the sense of you think it's edible because it doesn't affect you immediately, but it's not edible because if you ate a diet of this for an extended period of time, you're gonna get sick. And it's really sad, especially that they put so many of these toxins into our foods that kids eat. It's like they make this stuff appealing for kids, and yet kids have growing brains. They have, they're at a place that's very susceptible. They need whole foods. And it's just so hard as a mom, as a parent to serve kids those kinds of whole foods. Do you have thoughts or ideas or any advice for someone who's maybe looking to create a healthier diet and they have picky eaters or picky kids that's like not going to do it?
Picky eaters they're rough. It's very difficult and challenging as a parent when you have a child who just really doesn't like to eat a lot of things. And sometimes it's a sensory issue with certain kids. They just don't like certain textures, and that's complicated. One of my kids had, I think, a sensory issue, and it took me a long time to get him to eat good food. And I he will refuse to eat any kind of vegetables. There was only ate carbohydrates, only really liked bread, pasta, and meat, and zero vegetables. And so I had to learn how to hide vegetables in food. So a lot of it was what I ended up doing for him was pureeing vegetables and mixing them into meatballs. And so I'd have these, organic meatballs with pureed vegetables. It was mostly pureed vegetables with some meat and a lot of sauce. And, that's kind of how I slowly introduced. Then I started getting more chunks of vegetables into the sauce, and then eventually the meatballs kind of went away. And then I just had food that looked like adult food. It was a very long transition in his case, trying to figure it out. I mean, that the meatball story worked for him, and I've recommended for other parents, but it didn't work for some other kids. So there were some other kids who could the parents said that they could taste the broccoli in the meatball. I was like, I was out of ideas for them. Like, I didn't know what to do. And what I would often recommend is with some of the kids was just have one bite. I had this one patient. She was a teenager. She'd be an adult by now, and she hated vegetables too. But I didn't make her, but I suggested that she just have 1 teaspoon of vegetables, and she just had to start with that, and then she could eat whatever else she wanted. But that was our starting point, a teaspoon of vegetables. And she was a teenager, and she refused to eat vegetables. Her mum tried so hard, but, she just wouldn't. Fake vomit or something. It's tricky, very challenging.
I will say I don't personally like vegetables myself. I don't like them. I eat them. When I got into years ago, when I got out of high school, I was really super skinny. Like, I had a hard time putting weight on. And I got into bodybuilding and weightlifting. And that was the only way I could gain weight. But I still struggled to gain even weight through that. But at least I could hold that weight. Like, once I gained it, I could hold it. And I got really involved in that whole like fitness type industry. And that's what changed it in me, where I didn't grow up eating vegetables either. My parents never made me eat them, but I'm like, I know I need these because if I want my body to be a certain way and I
Yeah.
want to perform a certain way and I want to feel good in the gym, I need to eat these things. So sometimes I maybe finding an ulterior motive, a reason to want more, but that's hard in little kids. It probably works like in your teenage patient, but in little kids sometimes it's really hard because they don't care. They just want what tastes good.
Yes, it is. And I think that kids in general like sugar. They like fake tasting food. I can tell you from personal experience as a child, all I really wanted to eat was candy. So I get it. I totally get it. But I fortunately was raised by parents and a family that encouraged a balanced diet. So I was allowed to have some candy so long as I ate all my, my proper food first. So that's the model that I worked with my kids. You can have a little bit of a treat or a little dessert, but you have to eat all your vegetables and the rest of your food first, and then you can have a little treat. So I would dangle this, candy in front of their face. So you can have this, but you got to finish everything else first.
So knowing that the effects of trauma on the body, knowing the effects that our food has on the body, and knowing that we can actually feel better from trauma responses if we eat a holistic diet and a healthy diet, and we're putting healthy things into our body and into our system. With kids, especially with kids being so, their brain is still developing, could feeding them an artificial diet or a toxic diet, and I'm using those words, I know they're supercharged words, but feeding them basically the American diet that we feed kids, the overprocessed, could that have long-term effects, especially a child that's maybe struggling through childhood trauma or having something happen to them traumatically in their childhood, or going through something traumatic? Unfortunately, sometimes as human beings, we are in the middle of trauma that we can't necessarily escape. And it's really sad for kids, because if you take abuse, for example, if they're in an abusive home, it's not like they can just walk away from that. So they're experiencing these long bouts of reoccurring trauma. Does the I know the food has an impact, but could this create more of a long-term effect because their brains are still developing?
Yeah, that's a really good question. I don't know how to answer that well, but I do think that from the work that I've done, that even if you've had a really awful diet, that the body can heal and the mind and the emotion can heal. And it might take longer. You might have a delayed response. But if you do get on a good diet, even though you might have just eaten candy and box food your entire childhood, because I have met people like that, and then they changed their diet as an adult, and they actually did very well. So as long as you at some point are able to change your diet and get back on track, I do think that you can detox the body. And because the cell renewal in general, we have a new body every 7 or 8 years. So all the cells that we have in our body now, we didn't have 7, 8 years ago, because of this renewal, that I think that we are able to if we clean up our diet, we will have literally a new body. It might take time, as I said, but it can be done.
Yeah, that's very encouraging, actually. And I I had that question, but now that I've asked you and you've answered it, I can totally see how that's true. I do think that's true. I grew up on a diet of complete crap. Like,
Yeah.
it was fast food pretty much. Because my parents were young when they had me, and we ate. I grew up on Taco Bell and
Yeah.
Burger King and McDonald's. And then as I got older into my teenage years, that's when I really began to change that. And now I can't even, I couldn't even imagine going to any of those places mentioned. We still do some fast foods, but that try to do the healthier versions of the fast foods. So I can see how the body can regenerate itself over time.
Yes.
And I was gonna say, I just think I'm a testament to that.
Yeah, absolutely. And I don't believe that we need to be 100% like perfect with our diet. I think that the average healthy person can have a diet that's about 80% healthy. So you can have 4 meals a week or 5 meals a week with dessert, and you can eat junk, you can eat whatever you want, really, in that. If you keep it to that amount, go enjoy your cheeseburger or whatever, pizza and Taco Bell, whatever that you really love to eat. But I think if you keep it in moderation, you'll still stay pretty healthy. Now, unfortunately, that does not always ring true for people who are very ill. If you have a chronic illness, you have some kind of a condition, there are maybe short periods of time, or for some people, unfortunately, long periods where you have to have a squeaky clean diet if you have a condition, a serious medical condition. But for the average person, 80%. You go eat your candy, a little bit of it, chocolate cake, whatever you want, occasionally. Won't affect you.
Yeah.
Yeah,
Yeah, the body is amazingly resilient. That
it
is
is.
that is true.
Yeah.
So, with your master's in spiritual psychology and the consciousness, the healing, and the health, talk to us a little bit how that kind of ties in to what you do and what we've been talking about, which is this holistic approach to medicine.
So I think that getting your thoughts and emotions aligned with your physical body will help to accelerate healing. For example, if you have self-defeating thoughts, for example, I'm not good enough, I'll never be healthy, I'm never going to get out of this situation, then it's very difficult to work with negative thought patterns. It ends up becoming often, not always, but a self-fulfilling prophecy. And it's as a provider very difficult to work with if somebody comes in and they're determined that they're not going to get better. So, but if you're open-minded and able to tell yourself, I am not feeling great right now, but that is today and I'm going to heal. Just that alone. Or maybe there are better possibilities for me in the future. Just having that little sliver of an open mind will help to change the way that you think about yourself and your body. And some people believe, for whatever reason, especially if you've had trauma from a young age, if you've gone through a lot of abuse, under 7 years old in particular, because you go through this egocentric phase where you believe that everything bad that happens to you is because it's your fault. Yeah, it's just this developmental phase that's unfortunate that we all go through. Then often you have developed some kind of low self-esteem and you feel like you should be punished or you shouldn't ever feel better. And so we have to work with that to help you realize that, not you, but any patient, that you're worthy of being healthy, you're worthy of having good things in your life, having good health, whatever it is that you want. And to align that with your current level of real-time thinking, I think is key for good health, to overcome that trauma from childhood and that negative programming.
Yeah, I definitely believe there's a huge correlation there. I had an aunt who she got cancer, and when she was going through her cancer like therapy and everything, she had a very she it's like she had given up. She was like, I'm going to die. And I remember thinking, quit telling yourself that. But this is really a problem also specifically with cancer because, well, I guess it could be with anything. I just have more familiarity with cancer.
Yeah.
But when doctors come in and they say, this is your prognosis, sometimes that does put in people's mind, this is it's as good as like contract, like it is my prognosis. And it doesn't have to be. And when you start looking at stories of people who have overcome cancer and doctors have not given them a good prognosis yet, they've overcome it, or anything really. I mean, I've had people tell me things that is unbelievable that they've overcome because they had the mindset to overcome it. So there is some major validity in that. And fortunately, in my aunt's case, she passed away. She had, I think, from the time that we had this interaction in the hospital, she lived about 2 more months after that, which the doctor was telling her, and it was almost as cut in stone. But I think the mindset has a huge emphasis on what happens.
Absolutely, I agree with you. And I think that patients need to be told that these are statistics, but you are not a statistic. Survival has so much to do with will, and not to also suggest that then it's your fault if you don't overcome an illness either. I don't want patients to feel blamed that they don't get better, because for whatever reasons, for genetic reasons, some people can't heal, and for many reasons. But there are cases when I do think that the mind plays a huge role in terms of outcome, and to be able to be realistic and say, I think to say there are cases where people do overcome this cancer and are still alive against the odds. I've had a patient recently who was diagnosed with pancreatic cancer, and I think he's going on 2 years plus or something, and doing quite well, but that's not a prognosis that's common. And I think he just kind of has it in his mind that he's going to be okay, which I think is great and so inspiring. That
Well,
that's, yeah.
also, I was going to say this too. Sometimes by changing that mindset around this, so take a cancer patient, for example. If if they believe that, "No, I can fight this thing and I have the will to fight this thing," sometimes that influences their decisions to do certain things. So maybe they go on a all juice fast, or they start getting rid of everything that's cancer inducing.
Yeah.
The microwave, they say this is cancer inducing. I've often thought to myself, Lord, if I ever got diagnosed with cancer, I would not do chemotherapy. Not in a million years. I wouldn't. I'm not saying chemotherapy is bad for everybody. Everybody has to make their own choice, and that's a really, really hard choice to make. But I think there's protocol that you can do sometimes, and not just in cancer, but in anything, where if you have the will to live, you have the will to do these things, which kind of affects the outcome.
Absolutely. I think the will has so much to do with how we heal, and it affects our choices that we make. There was a study done with cancer in terms of survival, and they have actually found that the people who are quite gung-ho with their treatment outlive the people who just think that they give up, the ones that give up. Huge difference in terms of outcome. Interestingly enough, the people who actually went into denial about it and pretended that they didn't have cancer also survived quite well. So there's something to be said about denial and coping mechanisms, that sometimes it can actually be working for us too. It's just to kind of keep that in mind, that it's not, denial is not always a bad thing. But yes, the mindset. If you deny it or go gung ho, you're much more likely to survive it than be defeated by it. If you do, it's unfortunately then that becomes a death sentence.
That's interesting. I didn't know that
Yeah.
about denial. I wouldn't
Mhm.
I wouldn't think that. I
I
mean,
know, me neither.
but it's interesting that studies show that.
Yeah.
One thing one thing I did want to say that you brought up, and I think is so true, and I can come across sometimes as being like super harsh, and I don't ever mean to be, but is that, you should not ever feel guilty, because I did know someone who did pass away from cancer, and she had a very, very positive outlook. And I think just letting people know that sometimes, genetically or whatever, it's just, but if we can make the decisions to do the things to fight it, and again, we're talking about cancer, but really this could be anything. Healing, I think, is another thing, like healing from an accident, or healing, any healing process from any disease, or, you know, autoimmune. Like, there should be that fine line of like, I'm not going to feel guilt, but I'm going to try to do everything I can do, which is everything I put into my body, take account, and everything that I'm putting into my mind. Sometimes I believe that news is our modern day media can be detrimental to our mindsets. It gives us doom and gloom. I don't even watch the news.
Yeah, I think that, it doesn't matter what your political beliefs are. If they're not in alignment with you, it can just cause a lot of stress. And to be very cautious about what you're reading and what you're watching, because it does trigger fight or flight if it's disturbing. And if something's upsetting and you keep repeatedly watching the news, that's not great. I often recommend to my patients to cap how much news that you consume in a day, because it's just going to make you anxious, because there's no such thing as good news. Good news doesn't, we don't, it's not sellable.
That's right.
Yeah.
That's
Like,
right.
who's going to want
It's
to read about, the person that almost got hit by a truck and is doing great? That just, we don't read about that. It's always
that's right.
about, as you said, doom and gloom, negative.
Well, it's unfortunate because it goes back to the same thing, like what runs our modern media channels. It's money and it's viewership. So there's an ulterior motive behind the news that was getting put out on these channels, is, hey, they want viewership, and good news doesn't get the same viewership as traumatic news.
Yes.
And it's a vicious cycle. But I love having people like you come out and share these things, because it's so important for people to know. And I feel like once people have an awareness around these things, then you can combat them. Then, I can do certain things and choose certain things to ingest in my body that's going to be healthier options and choose what's going into my mind, because that's
Absolutely. Yeah. And just going back to the news, like, people want to often stay informed about what's going on. And I've asked this question to many people. And in general, people say if you just read something, it's less impactful than listening or watching. Watching images, bad images, seems to be the most negative, has the strongest impact. But if you just read bullet points, it's not as, like, if you want to keep up on what's going on, it seems like just reading small little points, because reading it just doesn't have as much emotional content, I think, rather than an image or hearing somebody's voice.
I can attest to that as well,
Yeah.
because I've done photography for years, and I can say that there's a lot more. Your mind remembers a lot more on an image versus on
Right.
just text. Yeah.
Mhm.
So it makes sense, if you're doing marketing, you want to use images to make people remember you.
Yeah.
If you're, what you're reading negative to put into your body, you would probably rather read that than look at images. That makes perfect sense. So you are a wealth of knowledge. I mean, you have a lot of knowledge around all of these things, and I feel like, you have a mission to help people, and that's a beautiful thing because it's needed today and going forward. Uh, do you think that America, like especially in scope of things that's just happened? So now we got a new health advisor. I think I'm saying that right? That's going to be coming in, ushering in change around health specifically. And do you think that America is on this right track? Because let me just preface this by saying this. It's really sad that there's foods in America that's on our shelves that are not legal in the majority of the world. Like food dyes is one of those things, right? And food dyes is detrimental. I know, like we've looked at this a lot with my children, who, there's neurological things in their genetics, and so it's like I'm not going to let them eat food dyes that cause neurological problems. But do you find that there's hope in our country, here in America, that we might see an improvement, especially with some of these toxic chemicals that's in our food?
I'm not sure how to answer that because I am only exposed to people in New York City who and tend to have a decent awareness about it already. I can't speak for the rest of the country. I wish for everybody that they at least had access to this information so that they could make an informed decision in terms of what's best for them rather than just being given without having the options. Because I think the issue is really to do with education and access to information, where a lot of these people don't have that.
Well, you're doing that by spreading the word on podcasts and, spreading the word and spreading knowledge. And it's easy sometimes to get into our circles and, but I feel like your voice is getting out there more. And so I applaud you for that, for sure. And I know that this is a touchy area, especially because we've seen doctors be persecuted for standing on some of these holistic approaches. So I applaud you very much for your mission and what you're doing. And I have to ask if, with all of these things, all of the things that you've seen, all of the things that you have going on, you see in your patients and the improvements that you've seen, do you feel like you're in your purpose doing what you're doing?
Yeah, I think so. I think that I am somewhat on track with what I'm happy to do. What I am, I'm happy in my career. I'm also happy writing a little side gig situation that I have going. A lot of the things that I do in my life, I think, bring me a tremendous amount of joy in terms of my career. And also with my own family, too, in my personal life. I think that my life in general brings me a sense of purpose and joy.
Perfect answer. So tell us a little bit about what you have going on. Do you like writing? So do you have a book? Do you have a blog?
Yes, so I have two books. I have another one coming out, hopefully fairly soon. I'm going to be looking for a publisher for my third book. But I write mostly about, well, the first three books, mostly about trauma and trauma recovery. So very much on point with your show. And the first one is about death and illness. My second book is about sexual trauma. And the third book is about suicide. So all very, very dark topics. And I go into quite a lot of depth from different angles. My first book is a memoir, and the second and third are fiction.
I love that. I need links to all of your books so we can put that. I know some has not come out yet, but we definitely want to make that accessible to my audience as well, because these are things that, people struggle with and need guidance through. And a book is the best way to really gain knowledge and access. You just have to devote the time to it. So I think that's wonderful. You're a practicing doctor. Do you take new patients there where you're at?
Yes, I only see people in person in New York City. They have to come to my office.
Yeah, that was my next question. Yeah. Do you see people virtually?
No, I don't. Yeah.
Well, that's awesome. And you're doing amazing things. And I appreciate you sharing the wealth of knowledge that you have. If you had to leave my audience with kind of one big takeaway or one thing that you would like to just leave them with, what would that be?
I think to keep going. Success isn't about making mistakes. It's about, if you do make a mistake, to get up and to keep going.
Yeah, I love it. So in other words, you can turn it around. If you're eating a really crappy diet,
anytime,
you can always turn it around.
It's never too late. Tomorrow's always a new day.
I love it. Well, thank you so much for coming on today. I appreciate it. I've loved the hour that we spent. I wish we had so much more time to talk, but thank you so much.
Thank you for having me on your show.
Thank you for listening to Through the Trauma podcast. If you have found value in this episode or believe in the mission behind what we are doing, please subscribe so that you never miss any future episodes. Also, be sure to check out our transformation project at transformationthroughtraumaproject.com, where we help inspirational stories get heard on a larger scale through multiple platforms. If you know someone who can benefit from this episode, please share it with them. Until next time.